Hey, it's Mo Egger. Do you love college basketball as much as I do? Then you will love Long Necks. They've got a great TV setup with 4K TVs all over the place, and the sound is always on for the big games. The beer selection is terrific, and if you tried Long Neck's wings, you owe it to yourself. 3 locations in Northern Kentucky, each one of them very easy to get to. Wilder, Hebron, and Richwood. And keep in mind, when the weather gets warmer, each Long Neck's location has an awesome outdoor setup. Long Neck Sports Grill. Stay late, come often. One thing we've done every Wednesday since late August, we talk injuries and mostly NFL injuries with one of the experts at OrthoCincy. The great thing about OrthoCincy is they've got specialists and locations all across the tri-state. They've got walk-in orthopedic urgent care weekdays from 9 to 9 and Saturdays from 9 to 1. You can learn more at OrthoCincy.com. That's OrthoCincy.com. Dr. John Fritch from OrthoCincy is with us. We're going to talk about Jonah Williams and Joseph Ossai. I also want to talk about a future NFL draft choice. Let's talk about Jonah Williams. We got an update this week. He has had surgery to repair his left kneecap dislocation. And the reports are the procedure is going to ensure that the kneecap dislocation doesn't happen again. Is this the standard procedure for a knee dislocation?
Yes, absolutely. It's a pretty common orthopedic procedure. Usually what we do for this is called an MPFL reconstruction, or reconstructing the medial patellofemoral ligament. In that, the ligament typically acts as a check rein to prevent the kneecap from dislocating out. So by reconstructing that with a cadaver tendon, because the normal one after you dislocate it is stretched out or torn, by reconstructing it, it should help prevent it from coming out.
What should the next few months look like? Because what we're hearing is he should be cleared for activity and be good to go for the start of training camp by the time June gets here. So between now and then, what does the path back to the field look like?
Yeah. So initially, it's going to be a little slow going. Usually patients are on crutches and in a knee brace for the first 4 to 6 weeks. They gradually progress, working on getting their motion back and then getting their strength back. Especially in these high-level athletes, we're able to progress them a little sooner. So we start doing some strengthening at 6 weeks and then get to more sport-specific exercises at 3 months, hoping in anticipation to get them back on the field by 4 to 6 months.
Got an update about Jonah Williams this week. We also heard about Joseph Ossai, who apparently suffered a torn labrum during the season and had surgery recently to repair the issue. This is a torn labrum that he played through. He was on the field. So describe for me the differences between a labrum tear that may allow a player to play through and one that would put them on the sideline for a bit.
So first off, these NFL athletes are playing through some injuries that more common folks like us aren't able to. They're tough dudes. But in general, I mean, the labral tears that are associated with sitting out for a while are the ones that we see when your shoulder dislocates, when the ball pops out of the socket. Especially if it pops out more than once, then people are usually sidelined in a sling doing therapy. Sometimes they're getting surgery. Other labral tears are more the result of repetitive injury, repetitive trauma over time. So, I mean, being a defensive end, getting your hands up and really pushing on the shoulder can cause gradual tears in the labrum. And that's a painful thing to play through, but in general, surgery can wait until after the season.
How complex are procedures for labrum tears?
I mean, although they're complex, I mean, they're very common orthopedic procedures. We perform them almost all the time. Nowadays, they're almost always minimally invasive, arthroscopic, done through these small half-inch incisions. We go in, we inflate the shoulder joint, we get in there, and we reattach the labrum to the socket. The labrum's like the gasket that goes around it to help stabilize it. We use these little suture anchor devices. They're essentially these small little screws that screw into the bone and allow us to tie it back down so it'll heal in the place where it's supposed to.
You've made that seem so simple. So should I assume that he should be good to go for the start of training camp?
Yeah, absolutely. So, I mean, he'll be in a sling initially. Normally people are in a sling for around a month or so. But during that time, they're doing daily training, especially at his level. They're making sure he's prepared and ready to go. Usually, again, starting sport-specific training at 3 months and hoping to be at a high level of return for about 4 to 6 months. So hopefully ready to be on the field by 4 months.
Obviously, we're going to be paying a lot of attention to players who got injured last season and their returns to the field and time for training camp. But obviously, the draft is coming up, and so there's going to be focus on the injury history of a number of draft prospects. I want to ask you about one, Nolan Smith from Georgia, who suffered a torn right pectoral muscle back in October, didn't get a chance to play for the Bulldogs during their run to the national championship. This is a guy who is projected to be a number one pick, or a first-round pick, I should say, in the NFL draft. But I want to talk about torn pectorals. What are some of the common causes?
Yeah, so, I mean, this is almost exclusively an injury in male athletes. We most commonly see it actually during bench press when you're really activating your pectorals, especially in the downward motion where you're doing eccentric strengthening, essentially where the muscle's contracting but elongating. Also can happen in our football players, essentially whenever their pec muscle is tensed up and their arm gets pulled back, it can pop off of the bone. We think about J.J. Watt in his injury 3 seasons ago now, and he ended up having surgery for it as well.
What are the various treatments for torn pectoral muscles?
Yeah, so for athletes, almost exclusively surgery. Other treatment options, we can put you in a sling for a little bit of time, some therapy to work on strengthening, but really we only do that with our less active elderly patients because there are very noticeable differences in strength, appearance, and ability to perform at the level you need to perform.
Fantastic insight. I appreciate the time. We'll do it again soon, Doctor. Thanks so much.
Yeah, thanks so much for having me on the show, Mo. I appreciate it.
You're very welcome, Dr. John Fritch from OrthoCincy, OrthoCincy.com. The great thing about the people at OrthoCincy, specialists and locations all across the tri-state. And that includes walk-in orthopedic urgent care during the week from 9 o'clock until 9 o'clock, 9 a to 9 p. And then on Saturdays from 9 to 1 in both Edgewood and Eastgate. It is easier and most definitely cheaper than going to an ER when you've got an urgent orthopedic injury. Go to OrthoCincy.com. That's OrthoCincy.com. Hey, it's Mo Egger. If you love college basketball as much as I do, then you will love long necks. The 4K TV setup is awesome, and by the way, the sound is always on for the big games. And if you tried the wings at long necks, you owe it to yourself. Plus, no place in Northern Kentucky has a better beer selection. There's 3 locations, Wilder, Hebron, and Ridgewood, each one of them very easy to get to, each one of them with a great outdoor setup for when the weather gets warmer. Long Neck Sports Grill. Stay late, come often.